Hi,
Hi,
can you tell me your full name and date of birth, please?
my name's Melody Smith.
Okay.
My birthday is September 23rd, 1992.
Okay, very good. All right, Melody, my name's Erica Gano. It's nice to meet you.
Nice to meet you too.
What brought you to see me today?
Well, I've had a lot of things going on recently. Um, I've been having issues with my husband.
Okay.
We've been married for 4 years, and we just really have not been getting along for the past 4 months.
Okay. Can you tell me a little bit more about that? As far as what do you consider not getting along? Can you describe a situation for me?
Yeah, we fight all the time, and it's not physical fighting. It's just nitpicking at each other. We recently moved to a new house, and we just don't agree on anything
Mm-hmm.
about this new house.
Mm-hmm.
Um, we're just having trouble with financing the house. Not really so much making the bills, but just it's more than when we
Mm-hmm.
rented. And I don't know, we are not communicating well, and it's been really hard.
Okay. All right. Well, before we get more into that, let's back up just a little bit. Okay,
Okay.
so I do want to know you're coming here today for the first time, and I want to build a relationship with you. So I just need to ask a few questions, get a little more information on you. Okay.
Okay.
Um, so, so you all just bought this home. Do you both work?
Yeah, we do both work full
Okay.
time.
Okay. And would you say financial issues are there, or is that really not actually this?
It's just different. We're still able to pay our bills
Mhm.
on time, everything like
Mhm.
that. They're just higher.
Right, a little more strain, maybe.
Yeah, yeah.
Okay, okay. So tell me a little bit about just now. This is just you personally. Um, Prior to seeing me, or even through primary care, have you ever been told that you may have depression, anxiety, any type of psychiatric disorders in the past that you're aware of?
Yeah, I've been treated for like a mix of anxiety and depression. I've taken Zoloft before.
Okay.
I don't remember how many milligrams,
Okay.
but I took it for about a year and then I stopped taking it.
Okay. Why did you stop taking it? Do you
I felt
remember?
better and I
You
just felt
felt
like I
better.
didn't need it anymore. Yeah.
Okay. And how long has it been since you've been on Zoloft?
Probably about 4 years, so before
Oh,
we got
okay.
married.
Okay. Before you got married.
Yeah.
Okay. Okay. Are you on any medication at this time?
No,
Okay. Do you have any medication allergies?
not that I know of, no.
Okay. Okay. Do you have any strong family history of mental health issues, disorders?
Yeah, my dad was diagnosed with bipolar disorder.
Okay.
Mom, she didn't really have anything psychiatric going on. She's had like heart disease and diabetes.
Okay.
And I have a little brother. He hasn't been diagnosed with anything that I know of.
Okay. Okay. Um, can you tell me a little bit about mom and dad's relationship growing up as a child?
Yeah, so they're still married now, but I remember when I was younger, probably about, I don't know, like 8 or 9 years old, they fought a lot. They fought a lot to the point where they were screaming in the house, arguing all the time.
Mm-hmm.
I think that mom was concerned about dad cheating on her, but I don't know that there was ever any like evidence of him doing that. I just remember them screaming, yelling. I remember they did go to counseling and they did end up staying together.
Okay. Okay. So, when you were 8 or 9, so you have a younger sibling.
Yeah,
Um, how much younger?
3 years.
Okay, so five-ish years was the sibling. Okay, so um, during that time, do you remember having certain feelings as far as did it scare you? Did it make you sad? Like, do you
Yeah,
remember?
yeah, it definitely made me sad and scared.
Okay.
I think that I still did okay in school, and I remember still going to school regularly.
Hmm.
I feel like they tried to hide it from us the best that they could,
Okay.
but we could still hear them, and it was a sad time.
Okay. Did they ever talk to you about actually what was going on, or you just assumed you heard certain things?
I mean, at one point, mom did kind of sit us down and say, Dad and I might not continue our relationship, be together anymore.
Okay.
So she kind of warned us, I think, when they
Okay.
were in the thick of it. But we never like went to a counselor or a therapist about it as a family.
Okay. Do you remember worrying about that quite often when you were
When I
young?
yeah,
Okay.
yeah. Especially after she brought it up, I thought it was for sure going to happen.
Right.
And I'd had a couple of friends who had parents that were divorced, and
Right.
it was sad.
Right. So did that go on for years, or was that just about, just an acute time frame, if you remember?
I want to say that it didn't last very long. I don't have an exact time frame,
Hmm.
but I don't remember it being super long
Okay.
lasting.
Okay. Okay. And as an adult, have you talked to mom and dad about that issue at all?
No, I never have talked to them
Okay.
about that.
Okay. And how would you describe your relationship with your mother and father now?
Good, good.
Okay.
We talk a couple times a week on the phone. They don't live in this state. We see each other on holidays, and
Okay.
same with my brother.
Would you say that you have a pretty close relationship with them now?
Yeah,
Okay.
for the most part.
And both equally mom and dad?
Mom probably a little bit more so, and she does know that I've been having trouble with my husband
Okay.
lately. I did disclose that to her.
Okay. Let's talk about a little bit more about you personally. You mentioned a little bit of anxiety and depression, the Zoloft. Have you ever been hospitalized
Mm-mm.
at any time for mental health
No,
issues? Do you ever have any suicidal thoughts, harming someone else, harming yourself?
no,
Any history of self mutilation, self harm type
no,
acting?
no,
Okay. Do you ever have any thoughts of hurting someone else?
no.
Homicidal
Not
thoughts?
serious. No,
Not serious.
no.
Can you describe that for me a little bit about what
Yeah,
thoughts you have?
I mean, sometimes I feel like I could just hit him in the face, but I've never acted on that, and I would never want to harm him or kill him.
Okay.
But sometimes I do feel that frustrated that I just want to hit him in his face.
Okay. So, what keeps you from acting on that?
Because I'm not a violent person, and I don't think it's going to accomplish anything
Mm-hmm.
in the long run.
Mm-hmm.
Might feel good in the moment,
Yeah.
but it's not going to get to the root of anything.
Okay. Have you told him that you have these feelings of aggression?
No. Our communication is not good right now because I think that we both just get angry and it doesn't ever turn into a meaningful conversation. It's more of just an escalation.
Okay. Okay. Um, do you, both of you or just you alone, ever partake in alcohol or illicit drugs or anything like that?
I'll drink wine, probably a glass or two, a couple of times per week. He
Okay.
does not drink alcohol at all, and neither of us use recreational drugs.
Okay. You don't feel like the wine is an issue though.
No, if anything, it calms me down.
Okay. And don't mind me writing. It's just I get caught up in the moment. And I just want to make sure that I don't forget certain things. So
That makes sense.
yeah, yeah. So I want you to be as comfortable as you can be. Okay. Do you have any questions at this point? I've been asking you a lot of questions. I mean, are you doing okay? Do you feel
Yeah.
okay right now?
Yeah, I feel very comfortable.
Okay, good. Okay, so let's dive in a little bit more. And I'm sorry, but you don't have any history of diabetes or thyroid or blood pressure, heart
No.
rate issues,
No.
cholesterol issues,
Mm-mm.
nothing like that.
No.
Okay.
I see a primary care and stay up to date on all
Okay.
that.
Okay.
Yeah.
Good. Good. Okay. And recent lab work? Have you had any recent lab work? You
Yeah.
said with primary
Mhm.
care.
Yep.
Okay.
Usually yearly.
Okay. And who's your PCP?
John Smith, Dr. John.
Okay. Okay. All right. So let's talk a little bit about back up as far as why you came today,
Okay.
and tell me specific. If you can think back, think of specific times that you and your husband. You use the word angry. So
Mhm.
tell me a specific time that you felt very angry with him.
Well, he was talking with me about the bills, and I just felt attacked by his tone. It just seemed accusatory to me, like You know, maybe we shouldn't have gotten into this. Maybe we're in over our heads.
Mm-hmm.
I don't know. Around the time we bought the house, I noticed also that he started working really late.
Okay.
And that's not, I mean, we're talking about like 30 minutes, an hour later than what he used to work. And I can't help but, kind of think back and wonder, is he cheating on me? Why is he an hour late? I
Okay.
don't know that his workload has changed.
Okay.
And maybe that's bothering me a little bit more than what I even, realized previously.
Okay. So has he given you any reason to think that he might be seeking attention elsewhere?
I mean, just being late.
Mm-hmm.
Being late.
Mm-hmm.
It's not something that's ever been an issue before now, and he doesn't have like a longer commute time
Okay.
or anything like that.
Okay.
I haven't taken his phone and dug into that. I don't know, feel like that's a pretty big breach of privacy, so I haven't done that. But I just can't help but wonder, like, why all of a sudden are you late? Are you
Mm-hmm.
why are you nitpicking at me? Like, are you trying to get out of this marriage?
Okay.
And it's been very, very, very hard.
Yeah.
Yeah.
Do you, and yeah, that would be concerning in a sense. So do you sometimes when he's late, do you think about your mom and dad's situation sometimes? I mean, does
Yeah.
that come up a little bit?
Yeah.
Did you ever see that maybe growing up? Did you see?
Maybe I did. Maybe I did.
Okay. Okay.
I don't know.
Okay. But there could be other reasons that he's late, right? I mean, other than that, have you considered the alternative reasons he's late?
Probably not because I just automatically go to the worst thought.
Sure. So, what would be other reasons that he would be late or working late?
I mean, our communication's been so bad. I don't know. Maybe he is, having trouble at work or
Mm-hmm.
has a higher workload that's keeping him late.
Mm-hmm.
Maybe he's, taking a little bit of time after work to decompress.
Yeah.
I mean, that could definitely be
Yeah.
a
Those are
possibility too.
right. Those are both feasible reasons for him to be a little late, right?
Yeah.
And if there's extra financial burden, you may want to ask that question of, are you staying late to get extra hours, or whatever that may be.
Yeah. Yeah, that makes sense.
Okay, so that may be something that you can look into a little bit between now and when I see you again. Um, okay, so do you feel safe in your home with
Yeah,
him?
I do.
You mentioned that the thought of hitting him in the face, but has he ever made you feel like you need to question your safety?
No, he hasn't.
Okay, good, good. So when you get angry like that and you have that feeling of I want to hit him in the face, what do you do typically at that point? To not hit him
To
in the
not hit him
face,
in the
and then
face.
what do you do after that?
To decompress, I usually like exercise. Sometimes I read novels. I talk with my friends. I do talk with my mom every now and then,
Okay.
and that does help. I've got a pretty good like support system
Okay.
outside of him, thankfully.
Yeah, that's very good.
Yeah.
That's good. So have you ever had any type of therapy?
No, this is my first time.
Okay. Okay. Well, that's good that you're open to it, and I applaud you for being here and seeking help. That's the first step
Thank
with
you.
this. That's very good. Um, so, we have to get more pieces of the puzzle together, right? We have to understand, your all's communication between the two of you. We have to understand you all enjoyed each other's company prior to getting married, so we have to figure out what changed between then and now, and we might have to back step. And once we identify certain issues that that maybe we can reevaluate or resolve, we need to look into that. Okay. Couples therapy is also an option too later on if we get to a point where we think, okay, we've got a good base now, maybe let's bring him in as well.
Yeah.
Right.
Yeah.
Okay. Are you contemplating leaving him, obtaining a divorce at
I
this
mean,
time?
if things don't improve and if he's not willing to also go on this kind of like therapy journey with
Mhm.
me. So I'm hoping that by me going to therapy, he may also like reciprocate and go to therapy too. Because I don't feel like this is just a one-sided issue. And I do want it to get better, but if it's not going to get better, then I want to know.
Okay. But you're willing to put forth the work. That's why you're here
Yeah.
today, right?
Right.
Okay.
Right.
Very good. And I applaud you for that. Very good. Okay. All right. So I'm thinking as far as, I gave you a few little tidbits that I want you to think about. For one, specifically triggers of think specifically of things that either happen in the home or that he says or does, or even things that you do. And I want you to kind of think about those and think of other options or other reasons why those things are happening. And I'd like you to maybe write those down, jot those down for me.
Okay, I can do that.
And I want you to kind of maybe even like do a little bit of a like diarying and things of, when certain things happen, do you think of past experiences, anything that happened with mom and dad, past relationships, anything like that, because that will help guide us and hopefully overcome past experiences and move on to present, right? And move on to the future. That's our goal. So I am interested in talking to you more in regards to emotional focus therapy. And it's kind of summed up of exactly what I just said. We're going to look at past emotions, past experiences that may be influencing your reaction today.
Okay.
So, your first initial reaction to him working late was, well, he's cheating.
Yeah.
Well, that is a possibility, but what are the other possibilities? And that's what we're going to work forward and move towards in our therapy sessions.
That sounds good.
Okay. All right. Very good. All right. Well, Melody, do you have any questions for me today?
I don't think so.
Okay. Would you like to see me again next week?
Yes.
On this?
That'd be great.
Okay. All right. Thank you so much.
Thanks.